My presentation is on MRSA. So MRSA is actually an acronym. It stands for methicillin-resistant Staphylococcus aureus. It's a type of bacteria. It's found on human skin. Staph is actually harmless, but it is likely to cause infection when it's activated that can lead to problems such as sepsis, and it can even lead to death. MRSA is caused by staph infection and is very difficult to treat due to the fact that it's resistant to so many different types of antibiotics. So MRSA is recognized now to occur in three different types of settings. It can be hospital acquired, which is obviously acquired in the hospital, usually in a long-term stay, or if you have depends on really your immunity, your condition, and who comes in and out of your room. You have the healthcare associated MRSA. This can happen in places such as an outpatient clinic that may not have cleaned good enough, and you sit in a chair that somebody had an open wound and had the staph infection, and then you touch it, and well, then you have it. Or it could happen when you've been in the hospital and you leave the hospital and you've acquired that infection. And then there's the community associated MRSA, and this can happen at home, sharing razors with someone at home, or towels, or it can even happen at work, sharing the same keyboard, touching the same things that somebody else has touched that has the infection currently, and it leads to you having it. So the probable cause of MRSA is it's usually caused by skin-to-skin contact, but like I said, it can also come from sharing razors with someone or towels. It's important to remember to just all your personal care equipment, to not share it with anyone, because there's a possibility that they could be a carrier of MRSA or MRSA, and you could end up acquiring the infection. There's approximately 5% of patients in hospitals that have MRSA in their nose or on their skin. And people who inject drugs with needles are 16 times more likely to acquire MRSA infection. So some of the signs and symptoms include redness, swelling, pain, warmth, pus and drainage, and even fever. Your symptoms depend on where it's at in your body. Depends on how your body reacts to it in different areas. But the way it's determined whether or not you actually have staph infection is through culturing. So you go to a medical professional and they may drain the sore that's on your arm or wherever it may be at, and they get that fluid and they culture it and test it to determine if you actually have staph infection. So contraindications and precautions. So you don't want to share razors or any personal care equipment. You don't want to pick or scratch the area, because what that's going to do is just cause it to spread, and they could just worsen your symptoms, your problems. You want to remember to clean your hands regularly, whether you're trying to prevent from getting it, or if you may have it and you want to prevent from giving it to someone else. If you may have that fluid or drainage on your hand, you can prevent somebody else from getting it by keeping your hands clean. You want to cover the affected area with a clean, dry bandage until you can get to a healthcare provider where they can determine what the next steps are to take, where as far as culturing, draining it, or maybe even doing surgery to get rid of it. So some early interventions, the first step would be to get to your healthcare provider, and they're going to determine what the next step is. First off, they're probably going to culture it. They're going to get a sample of the fluid, and they're going to test to see if you actually have staph infection. And if you were to end up testing positive for staph infection, what they're going to do is put you on some type of antibiotic. This could be through an IV or orally. Some of the new research methods that are taking place for MRSA, there's a group that started Reduce MRSA, the ABATE study, Project Clear, the University of California, Irvine, and the Rush University Medical Center. So Project CLEAR is actually an acronym for Changing Lives by Eradicating Antibiotic Resistance. This research is based on decolonization of MRSA positive patients following hospital discharge. So this is when they send them home with this medication. They found that 2 times daily mupirocin and oral wash chlorhexidine for 6 months led to a 44% decrease in MRSA. The ABATE study is also an acronym for Active Bathing to Eliminate Infection. It's a similar approach to Project CLEAR, but they're more focused on the actual inpatient and ICUs in the hospital. So even though there's a lot of research taking place, there's really no new treatments for it. I mean, you have those medications that they're working on, but really the best thing is what we already have now, which is these certain antibiotics that we can use to treat MRSA. There's also really no specific surgeries that they do to get rid of MRSA. I mean, if your doctor may decide that the best case scenario for you, depending on how bad your case is, he may decide to take you to an operating room and actually do the surgery to get rid of it. But usually they're going to put you on those antibiotics to treat your MRSA. So up until the 1950s, most staph infections were sensitive to penicillin. However, they became resistant to penicillin and methicillin, which is where it gets its name, methicillin-resistant Staphylococcus aureus. Hospitalized patients with MRSA are usually treated with IV medications via a catheter. In many cases, the person will be given antibiotics to continue once they leave the hospital. And the most common IV medication that's used is called vancomycin. And this is usually just a type of antibiotic that is monitored by your doctor once they're giving it to you. And there's different amounts of dosages that they'll give you depending on the severity of your staph infection. So with the home medications, as far as that goes, there's usually 7 to 10 day courses of antibiotics by mouth that they give you. These include, I can't really say this long name, but it's long for Bactrim. Then there's clindamycin, and then there's doxycycline and minocycline. These are the most common antibiotics that they give you to take by mouth once you go home, and you may even take them in the hospital. It's just extremely important, and we as therapists can do this. We can educate our patients on being sure to take the full dose and dose prescribed of their medication, because the way we build resistance to these antibiotics is by not finishing our course of antibiotics that were prescribed. So it's just important to educate our patients on taking the full dose or the full course. So as far as physical therapy goes, like I said, we can educate our patients on taking their medications like they're supposed to take them. We really want to educate them on hygiene. So maybe post-surgeries, we want to make sure we examine like their home. Do they have pets? If they have pets, we want to educate them on keeping the pet away from that incision, because what that's going to do is put them at risk for contracting this MRSA infection. We want to practice good hand hygiene, keeping our hands clean along with our patients. We want to also practice good clinic hygiene. We want to keep our areas clean, sterile. We want to use Clorox wipes whenever we need to, or anytime we have a patient, we want to always clean up behind them. That way we can limit the spread of this infection. And there's been some studies found that using low frequency ultrasound can reduce the colonization characteristics in MRSA. So just using that low frequency at 35 kilohertz. And then these are just some of my references that I used to gather the information for this project.